Hey everybody, I hope you didn't think I fell off the face of the earth. I just been busy with school. I'm taking pharmacology, drug dosage calculating, and intermediate algebra. Pharmacology and drug dosage calculating are first year nursing classes, but I'm taking them to apply to a college nearby my house. They're required there. They're usually not required for application, but for this school they are. And I thought I'd get a jump on some first year classes. I'm taking the intermediate algebra because it is required for an associate's degree in nursing at most community colleges here in California. Also, I've been getting flooded with comments, and I just have to say thank you so much for your support and your encouraging words, and it means a lot to me. And I too, right back at you. I'm really proud of y'all for taking this incredible thing on and changing our lives. And so intermediate algebra is quite a challenge. I had college algebra a long time ago, and when I studied the algebra for the T's, that kind of got me back in the saddle, so it helped. It's a lot to take on. I wouldn't recommend taking it with any other large classes. The pharmacology I'm taking and the drug dosage are just once a week. They're only 2-unit courses. They are pretty involved, but they go at a little bit slower pace. So I'm actually only grabbing about 9 units this semester. I think this is going to be my last semester prior to starting a program. So I put in 4 more applications for spring, which is a January start date, and I've got my fingers crossed. I did hear back from one of them. They disqualified me for a partial English course that wasn't completed, but I challenged them on it, and I think perhaps, and this is a long shot, but I am in discussions with the equal opportunity, I guess you would call it, department against discrimination, because the application at this school, and I want y'all to be aware of this because you might see it, had a demographic box that was required to be filled out, and a demographic box as your age, your race, and your gender, and that's illegal. It's an optional box only. It should be optional only, and I asked prior to application if I needed to fill it out because it did not say optional, and the lady on the phone said all areas of the application must be filled out or your application will be disqualified. So I'm going to blow the whistle on them. I'm not going to tell you who it is because that's not fair, but beware of age discrimination, racial discrimination, gender discrimination at these colleges in your state too. You do not have to divulge your age or your race or your gender. That's against the law on an application for a job or a school program. So anyway, I'm kind of ticked off about that. I applied to this school twice, and my application was denied. So, a little suspicious. What else? Oh, I'm applying to a school in, I'll just say, the Southern California area that is requiring my first 2 sets of Hep C vaccinations. There are 3 in the series that you need to get. The first one, or the second shot, is a month after your first shot, and then this shot, I should say injection or vaccination. The third vaccination injection is 6 months after your second. So beware that you will need Hep C vaccinations prior to entrance into any program, and maybe get on that and just get it done. I had my my TB test and rubella and all that all cleared for my CNA training, The Hep C is for nursing. So just a heads up on that. This school is requiring my first 2 injections prior to application. But I think it's because they're down by the border and they might get a lot of infection going on. So I don't know. That's just a guess. I speculate a lot. What else is going on? Pharmacology is a really great informative course on drugs, how they work in our bodies. It's very helpful if you've had your physiology and chemistry. Drug dosage calculating is basically a doctor might order 100 milligrams of a medicine, and the medicine might come in 25 milligram per tab. That's an easy math problem in my head, but it gets more complicated than that. So what you learn to do is you learn to convert grams to milligrams and micrograms to milligrams, the metric system, and so on, milliliters to liters, that type of thing. And then you also learn how to read a doctor's order and convert it into the correct dosage for your patient. There's a lot of mistakes being made with drug dosages, and in some cases, mistakes on a drug dosage can be fatal, and you'll lose your license. So it's a really, really important course to take. If you can take it prior to entrance, go for it. Mine's once a week for a couple hours, and there's homework weekly, and then an exam every month or so. And just get up on your math skills again, solving for X. What else? I'm really enjoying this semester because a lot of the people in the classes are focused and going into the healthcare field. So we all have a lot in common. The intermediate algebra is a challenge. Like I said, I started out really strong, and then I kind of tanked on the last test, but so did the rest of the class. So it might have been the chapter, but it was a lot. I also got really sick with nasty rhinovirus, and then a GI tract infection, which, curiously enough, anybody out there ever had this happen to them, elevated my histamine levels, and I've been on Claritin for 2 weeks. I have contact dermatitis, almost like hives. But I know histamine levels will increase, sometimes even double, when the body is attacked by a virus. So I got attacked by 2. My immune system was down. The rhinovirus was really nasty and went right into my chest. But I didn't need to go on antibiotics. It didn't go bacterial on me. I tried to take care of myself, and I did the old home remedies in combination with pharmaceuticals. So chicken soup is wonderful, and hot honey and lemon, and I hope none of you get that flu. I would call it a flu. I guess I had a flu. I haven't had a flu in 15 years. But anyway, so hey out there, I'm really loving the comments. I've been asked to help some people, and I'm all up for that. I wanted to give you a heads up on, if you're just starting, just focus on your prereqs and go see a counselor. Go on your whatever state you're in, Google Board of Nursing, like Texas Board of Nursing or Ohio Board of Registered Nursing, and then it'll give you a list of certified schools in your area or in the state that you can apply to, and usually there's a link to their websites, and you need to read each one very carefully and develop some type of system. I have a spreadsheet that says, well, this school requires, of course, your science prereqs, but it might require nutrition, it might require pharmacology, it might require intermediate algebra prior to application. So be very, very careful. Try and avoid pitfalls along the road, saying, oh, shoot, I didn't know they needed that. Print out their application and take a good look at it. If you get really confused, go see a counselor. Most schools are taking them by mail. Here, I do have to fly down to Santa Monica to apply to their program. They won't take anything by mail, which I don't understand. That's crazy, but I've got Southwest airline miles. So if you guys if you guys have any specific questions, please feel free to comment. I'm checking my videos weekly or more often. And I'm still here. I'm finishing school in December, and if I don't get into a program in January, I've got 19 more applications for fall 13. I'm going to have to go to work. I can't go to school anymore. I'm running out of things to take, unless I want to go on take some oil painting classes. But that's not a good idea. I need to make some money, so I'll probably use my CNA and go get a job, or do some home health care, maybe. I'm not sure. I'm a little nervous about it, but for now, I'm halfway through the semester, doing well, getting good, pretty good grades, B's and A's. So, go nursing. Go pre-nursing students. I'll talk to you soon. Take care. Have a great day.